So, I see that we have you here today because you're having some hip pain, correct? Okay. When did this start? Was there an injury? Okay. And did the pain come on suddenly or was it gradual? Okay. Would you call it a sharp pain? Is it dull? Does it radiate anywhere? Okay. Any numbness? Are there any movements or positions that make it feel worse or make it feel better? Okay. Okay. And have you been taking anything, supplements, pain medication to help with the pain and discomfort? How about, have you done any physical therapy, any sports massage? Okay. Are you using any ice? Good, okay. And let's see. What kind of exercise do you do? And how would you rate the level of intensity that you work out at? Okay. And last question, how frequently are you working out? And actually I lied, one more. Are you still working out even with the injury? Have you had to reduce the amount or stop completely? Okay. Understandable. Okay. So what I'm going to do to start off with is just check your joints. Some of it is going to be measuring, some of it is going to just be me palpating and feeling for inflammation, any muscle tightness or muscle imbalances. And then I'm also going to do some resistance checks, which I'll explain when we get there. And it's going to help me get a clearer picture of what's going on, so that way I know what role I can play in terms of your recovery. So, I'm just going to get some gloves. Okay, let's get my stool out of the way here. Okay, so it's your hips. Yeah, I'm feeling some tightness here. I'm going to pull your legs just a little bit to try and straighten your pelvis, okay? So, So I am feeling some hypertonicity in your quadriceps, especially the obliques, the inner muscle here. I'm going to push my palm against your foot and I want you to resist me, so don't let me push. Good. Other side. Push, push, push. Good. Now I'm going to do it the other direction. Don't let me. Good. Alright. I'm going to do the same thing, but this time I'm going to bend your leg to a 90 degree. Can you help me? Bend the knee. Perfect. Now push against my hand. Excellent. Can you hold it up by yourself? Good. I'm going to try to push it down. Don't let me. Okay. And don't let me push it up. Good. You can relax. Same thing, other leg. So you can bring this one up to a 45. Okay. Don't let me push it further up. Good. Don't let me push it down. And don't let me push it up. Okay. Now just hold for just a moment. You can relax. So I am seeing a slight strength imbalance between the right and the left. It looks like we have more power posteriorly on the left side than the right, which could be what was the beginning that led to this injury. Sometimes things are set in motion before we're even aware of it. And muscle imbalances, strength imbalances, or having more flexibility on one side than the other can definitely play a part. So, okay. Just checking for any lateral hypertonicity here. Calcaneus. Good flexion here. I'm going to test you for any potential numbness as well as your Babinski's reflex, which is the reflex on the bottom of your foot. This is going to be a little bit ticklish. Okay. Good. you can feel. Okay. So, I think you are a good candidate to do some adjustments. So we're going to be doing some cavitation, which is that bone cracking that most people are familiar with, as well as some activation, which is very gentle, just sort of nudging the joints into alignment. So I'll show you. This is the activator. And if I activate myself, see, it's very gentle. Don't even really see me move. So, first we're going to do the cavitation. So, you're going to be pressing your hips. I want you to take a deep breath in for me. And exhale. Good. Okay. Deep breath in. And exhale. Good. And other side. Deep breath in. And exhale. Good. Okay. Okay. How are you feeling? Okay. Totally normal to have some adrenaline from this. So now I'm going to be using the activator, okay? get you to raise this leg again at a 90-degree angle, bend at the knee. Good. Now I'm going to push down. I'm going to push you up. Try to resist me. Good. And opposite. Up. Keep it up. Don't let me push it down. Okay. And resist my hand pushing. Good. Go ahead and relax. I'm going to have you raise this one up again. 90 degrees. Perfect. Don't let me push it down. Don't let me push it up. And don't let me push it in. Beautiful. Can I relax? Okay. How's it feeling? Okay. Good. So give me just a moment. I'm going to go grab an ice pack, and then I'm going to get you a referral to some sports medicine, and we can talk about care. Just a sec. Let those sit like that. And I'm going to get a referral written up for you for some sports massage as well as some physical therapy, which is going to help and resolve this for you pretty quick. So I've written up a referral for you to get sports massage as well as physical therapy for the next 6 weeks or so. During this time, I would also like you to come back in and check in with me weekly so we can track your progress and take care of you skeletally while your muscles are strengthening and healing, okay? During this time, I would like you to put your focus in terms of exercise into the physical therapy. So whatever the physical therapist has you do in clinic, and then whatever homework they give you to do at home. Every week we're going to check in, see how you're doing, how you're recovering, and we will assess each time your progress and basically update a potential window of when you'll be able to resume your normal exercise. But until we get to a point where, say, you're able to walk for half a mile without pain, I would like you to hold off and just focus on recovery. Then in the meantime, also having you do some sports massage, and it should be covered by insurance. Generally, this is included with physical therapy plans, so I don't think it should be an issue, but we can get you some resources if you need them. Lots of ice, elevate when possible, and rest, okay? Okay. Do you have any questions for me? Our front desk will give you a list of different phone numbers of places you can contact. We do have our preferred providers for sports massage and physical therapy, which we work very closely with. So I definitely recommend starting there, depending on the proximity, of course, to your house or apartment where you live. Okay, but regardless of where you are, we have recommendations that we can give you. Any other questions? Okay, well then one more thing before you go is I'm going to give you some magnesium, and it is a spray. It actually absorbs really well through the skin. So this we do have at our front desk. It's just a pure magnesium oil spray. They have this at Whole Foods as well. So it's always good to massage it in. Okay, I'm going to go ahead and take these nice packs. And you are free to go. I'll see you back in a week.